There's a medical diagnosis for being trans. It's called gender dysphoria, and it's what I have. It means that my mind and my body don't agree about who I am. And evidence shows that when trans people align our bodies with our minds, our lives can improve in almost every single way imaginable. That's why I'm on the operating table today, to be whole. When we make these changes, we're better off.
A lot of people have very different things that they focus on in their bodies that make it hard for them to move through the world as the correct gender. For some people, that's their face. For some people, that's their genitals. For some people, that's their chest. And, we offer, as medical providers, hormones, and we have surgeons who do surgery. And those two things are what we have to offer to help people make those adjustments.
So silicone in here, she also said that you were interested in a C cup. 550 cc is equivalent to a C cup.
Okay, cool.
She's gonna make sure it doesn't look good.
Okay.
She's done it a lot.
I mean,
Yeah.
Good to see you.
Right.
You're going to cut me open and see me half naked, so you can.
So I can, okay. So the point of today was really just like more education, but today we just confirm that everything you picked is still true. So what we do is we put you to sleep.
Right.
You stay asleep.
Right.
We dissect out the pocket for the implant and we put a sizer in. And then with you still asleep, we sit you up and we assess based on your body type and your shoulders and the strength of your chest. You'll get a very natural result. You have enough breast tissue to cover the implant. It'll be a nice shape where you come out and then go back in and then go out again.
Sounds good. I'm in New Orleans to cover Netroots Nation for FSTV to talk to congressional candidates. Winning feels better. And mayors.
For community-based budgeting should reflect, the unique demographics, needs, and concerns of your community.
And to see up close a parade of presidential candidates.
They were getting away with it because those who ran the government weren't willing to stand up for working people.
It's just 2 days away from one of the most momentous events of my life, and I have no ability to think about it.
The surgeon's office called today to confirm everything. When they confirmed it, I had just finished an interview with Chokwe Lumumba. I just took down all the information and got off the phone and went on to the next thing. It's just been like that. So it's a very, very intense time. At some point, the reality of the transformation and the change is gonna hit me, but that hasn't happened yet.
The answer is going to be what we did, what action we took.
I was asleep for an hour and 15 minutes.
The question is, am I nervous? The answer is oddly no. The nervousness and anxiety was in all those years of 1, figuring out who I was, and 2, after that, fighting with myself about what to do about it, unpacking all of the baggage I had accumulated, tackling what we need to do inside of ourselves to feel whole. It's our life's work. It's at the heart of human existence.
Okay, so now it's official.
Ooh!
So those were the moments of anxiety, self-doubt, self-loathing, apprehension.
Yeah.
But today is one of those days where all I have to do is show up. There's nothing for me to do today but show up. All I have to do right now is be present.
I just want to talk about how you feel.
I think I'm loopy. So I think the thing that I feel right now is I actually feel an entire part of my body I didn't feel before. Like I was totally disconnected from this entire region. And now it's present. I feel it.
I'm about to leave the house for the first time in 8 days in order to go see the doctor to see how I progressed after surgery.
Soreness and tightness, that's going to last for a little bit. The incision is here and the implants, it rests around there, so sometimes that's where you feel
Okay.
a lot of soreness. So we'll have her come in, everything feels absolutely normal, but she'll just advise whether you need to wear both or not, probably just continuing the bra and not the breastband. Breastband we start in the beginning when you have that pressure installed.
Yeah.
How are you?
Good, how are you?
Good to see you.
Good to see
Are
you.
you good?
Yeah, it's good.
Looks good.
Yeah.
It's already gotten softer. So they keep getting softer, they kind of fall into position, they fall down into their natural shape, and it looks gorgeous. It's just that hard part of letting the swelling go down.
Right.
You look great.
Thank
You're doing
you.
amazing.
Yeah, thank you. They look really good.
Sure, good. They're coming into
Yeah.
their own.
Yeah, exactly.
Okay.
Exactly.
For me, what's interesting about my breast right now is that they're new, but they feel like they've always been there. It doesn't feel like I've changed anything. I'm a patient, but I'm also a journalist, which means that I have to understand the bigger picture here. Going back to talk with my surgeon is as good a place to start as any.
After the surgery, you really see somebody blossom. I think they come into their fullest sense of their self. They have renewed self-confidence. They do things that they didn't feel confident doing prior to surgery. They are more confident in their social interactions. They have more positive relationships with their family because they are living in their most authentic self. Historically, patients had to travel outside of the United States to receive care because it was not affordable here. And in 2015, there were changes in insurance coverage where there are some commercial insurers, and then depending on your state, Medicaid and Medicare also covers it. Covers gender-affirming surgeries. And so I think that there was fortunately increased access to care. There was increased demand. I do think that increased understanding of both the diagnosis of gender dysphoria and the treatment of gender dysphoria. So in the media, there has been increased discussion, and people now have the words to express the way they feel. We as physicians understand and have data that medical intervention can make a very positive impact on an individual's life, be it through hormones, through surgery, through just improved communication with family members and the confidence to express yourself most authentically. I've had patients come to me and say, I've changed my birthday to the day of my surgery.
But this access to life-enhancing and for some life-saving care is in jeopardy if the Trump administration moves forward with a reinterpretation of a portion of the Affordable Care Act, which has the wonky designation of Section 1557, but with a redefinition would remove equality in healthcare for trans people. I wanted to have a conversation with you because Callen-Lorde is the largest provider of trans healthcare in the United States. I wanted to start with an immediate concern about the possible reinterpretation of an obscure part of the Affordable Care Act. And so I'm wondering if you can just talk a little bit about what that means, what the interpretation of that means for transgender healthcare.
People are starting to rethink what this means. Is it that this type of care is going to be shut down? People are getting worried. There are some people who are saying, you know, I was a little bit on the fence about maybe accessing surgery. But if it's going to be taken away, I would rather just go ahead and get the surgery done right away. I've probably seen more people requesting referrals for bottom surgery, for example, than in the last 6 months or so than I have maybe in the last 2 years. There are people who are actually talking to me about slowing down their transition. I've had people talk about changing their gender markers back to, you know, their sex assigned at birth because they're just terrified. We're all worried.
People who are coming in and saying, I can't have surgery with you because I need to have it before coverage disappears, and our wait lists are too long. And I think that, you know, people are more willing to take risks on less reputable surgeons. That's a really devastating effect of transphobia, where people can't actually self-actualize in the ways that are best for them.
It is interesting that I'm going through it during the age of Trump. The fact of the matter is that I'm now going through all the things that I feared the most about transitioning. And when I say that, I mean dealing with bureaucracies that are totally, I think, you know, they're not very forgiving. And right now there are people have license to treat transgender people a certain way, as opposed to just a few years ago, that would have probably been a more, you know, peaceful time for me to transition. It wasn't something I was ready for. I'm ready for it now. And having to say that I have gender dysphoria, it's not something that sits well with me, because it's admitting there's something wrong. And that was something that I always pushed back against, saying there was nothing wrong with me. But also now now that I look in the mirror and I'm not in love with the person that I see in the mirror anymore like I once was, is that gender dysphoria? And I'm coming to realize that that's what that is, right? And so I have to tackle that head on. So that does mean that I do have to deal with these bureaucracies. Transgender people existed for forever. And there were, in some societies, we were revered.
When you started out as a physician, did you ever imagine that where we are right now is where we would be?
Oh, never. It never even dawned on me. When I started doing this care, it was over 2 decades ago. And, you know, it was still so small, and so few people we were even brave enough to come into medical settings to seek out this type of care. And now, you know, now it's completely different. I'm just so pleased that times have changed this much.
But beyond the medical, there is magic in trans and mystery in trans, because part of it is intangible and unknowable, yet highly, highly real. Next time on TransLash. So when you heard that I was transitioning, what questions did you have? Or what questions do you have?